Coming to the next one, the very typical triad of the retinitis pigmentosa. Very typical retinitis pigmentosa. So this is usually a boy bilateral night blindness. Usually a boy will come complaining of the bilateral side night blindness, and on examination you are going to get a typical triad. So what is the triad that you are going to get? One is this one, then number 2 is this one, and number 3 is this one. So one is the pale waxy optic disc you are going to get. Number 2 we get the pigmentary spicules. Number 2 we get the pigmentary spicules all around the retina, and number 3 we get the arteriolar attenuation. Arteriolar attenuation is also there. All the 3 things are there. So even if you have not examined the patient, but I give you the clinical scenario that the boy is coming with the bilateral, and not only it's bilateral, it is also symmetrical. Bilateral symmetrical night blindness along with this triad, you are very sure that this is actually a case of the retinitis pigmentosa. Now what are the other questions they can ask? They can ask you about the inheritance pattern. The inheritance pattern may the most common is the spontaneous. Always remember that it is actually the spontaneous one, rather I would say sporadic. It is actually the sporadic which is more common than the familial. Okay, it is more common than the familial. And out of the familial, if I ask you, then it is autosomal recessive followed by autosomal dominant and followed by X-linked recessive. This is there. Okay, so out of the familial, this will be the most common. Autosomal dominant will give me the best prognosis, while X-linked recessive will give me the worst prognosis. So there are number of questions. Another important thing, what are the tests that we can do? Tests that we can do, one is the perimetry that we can do. Perimetry may we get the typical ring-shaped scotoma, and we can do the EOG as well as the ERG. So which one is the best one? This is the investigation of choice. Another important question, it is the electroretinography that is the investigation of choice. Now what is important in EOG? In EOG we take the Ardens ratio or the Ardens index. Another important PYQ. Ardens ratio may we have the maximum peak upon we have the minimum peak. We have maximum peak, minimum peak multiplied by 100. This is the Ardens ratio. What are the normal values? So more than 185% is actually the normal value. Between 150 to 180 will be the borderline value. This is the borderline value. Then we have less than 150, which is subnormal, and less than 125 is actually flat. But if I talk about the ERG, if I talk about the ERG, here we have got the 3 waves, something like this is there. So we have got the A wave, B wave and the C wave. A wave comes from rods and cones. B wave shows the activity of the bipolar cells. So this is the first order neurons, this is the second order neurons, and C is the RPE activity. So all 3 are actually affected in cases of retinitis pigmentosa, and all 3 you can see here. That is why this is the investigation of choice. Okay.